right, we're live, Brian.
As folks are joining, if you want to just drop your name or a quick hello in the chat, we'd love to hear from everybody today.
Perfect. We got 30 folks on already. Caroline, hello from Delaware. I'm in Nashville, Tennessee, despite having the palm trees right outside my window. Don't let the palm trees fool you. Eric, hello from Milwaukee. I'm from Green Bay, Wisconsin. Brian Hershey. We'll let folks continue to shuffle in here. Uh-oh. Eric's living in Milwaukee, but a Bears fan. A lot of Florida checking in. All right, we're at 12:03, so I think we'll get started. We are recording today, so we will be able to share out the full webinar after the call here. We're really excited to have everyone on the call and really talk about how HubSpot is helping transform specialty care. We appreciate you all joining, and we've got a great partner here in the mix, a HubSpot implementation partner. I brought my buddy Bryan on from Aptitude 8. Bryan, I don't want to steal your thunder, so feel free to intro yourself, then I can intro myself, and we can dive right in here, man.
Thanks, Zach. Hey, great to meet everybody today. Bryan Byler, I'm the CRO at Aptitude 8. We're one of the leading technical HubSpot consulting partners, and we work with a lot of healthcare organizations. And today we're going to share some of the things that we're seeing in the industry.
Perfect. And my name is Zach. I'm a corporate account executive here at HubSpot, so I'm on our upmarket team. Work with partners all the time like Bryan to implement and work with HubSpot as a solution, specifically in the healthcare specialty practice place. And we're excited to show you what and chat about like what we've been seeing in the marketplace. Please feel free, drop comments. We'll have a Q&A session at the end. But feel free. We've got a couple of folks managing the chat. We want this to be conversational in nature. So if you have questions, drop them in and we'll try to get to them in real time. But if not, we'll definitely get back to them at the end of the call here. All right. So we are recording here. And again, we will share this out after. So if for some reason you need to jump, no worries. We'll get you the full webinar in a follow-up email here. All right. So what do we have on tap for today, right? So we're going to talk through the modern patient journey. We're going to talk about how HubSpot is HIPAA-ready, a HIPAA-ready CRM, how we can integrate to systems that are already in place at your specialty practice. We're going to talk through tactical use cases for practice growth. We've got a case study that Aptitude 8 and Bryan has worked with Intersurgical CRMs transformation. And then we're going to talk to how to get started with HubSpot and healthcare. And again, a lot of that information will be sent as a follow-up. So feel free to take notes, drop things in the chat. We're excited and ready to roll here. All right, next slide. There we go. Bryan, yep, take it away. I know you've got these chatting through where HubSpot wins.
Yeah, thanks for the intro there. Love to see it. So one thing is pretty clear to us is that the way that patients engage with healthcare, is changing, right? We're transitioning from these transactional relationships to those that are more meaningful. And a pretty notable statistic here, 81% of patients are willing to switch providers to receive a better service. Expectations are shifting towards convenience, towards personalization. Nowadays, patients expect the same level of service, in ease with their digital communications that they get from other industries, that they're used to getting in other industries. And so this means for us, like marketing, sales, and services teams, they all play a role in building that trust, but they've got to have the right tools at the heart of the tech stack in order to be able to meet their patients' expectations. And so in doing this, we're reducing friction, but also you're creating loyalty that may not otherwise exist. So let's talk a little bit about why traditional CRMs fall short. Quite simply, they weren't built for healthcare. There are industry-specific tools that are very specific, but many of those we see are kind of outdated, a little bit clunky to use. Some built on like access databases and order technologies. Many times they're siloed. It's hard to get data in and out of those systems. And these are challenges. We typically see there's not native support for things like HIPAA compliance, and customizing them can be really challenging. We've heard providers sometimes they need to pay thousands of dollars just to make simple changes to their CRM, even adding a few custom fields or something like that. But at the end of the day, what we see is these systems, while when they came out, they may have been effective, but they're really designed to manage transactions. They're not well designed to build or foster trust with your patients and support those long-term relationships that we really desire. So we've got a poll. Let's take it to the chat here. So which aspect, especially related to practice growth, is most challenging for you? Which aspect of practice growth is most challenging for you? And we've got a multiple choice here. So is it generating a kind of a steady stream of qualified leads? Do we see challenges with managing intake or scheduling efficiently, team coordination across departments, or retaining the existing patients you're working with today? Give it a moment here for some of the answers to come in. Oh, it's a tough race.
Yeah, pretty mixed results here, Bryan.
Is coordination going to take it? I think many organizations would agree, probably all four of these, some combination of the four of them. I think what I would say here is that what's exciting here is HubSpot can actually help solve for all of these.
And I think what we see a lot on the front end, with the poll is, hey, we get a lot of leads, but there's a lot that they kind of fall into a black hole after, right? We get a lot of form fills and, we're texting, but there's no like synchronized follow-up or automation that, puts them into a 12-touch flow over email, text, maybe some ads, right? Things can kind of fall off. So not only generating those leads, but then how do we communicate, make sure we stay top of mind to actually get them to step foot, in your practice. So excited to kind of cover some of that here today as well.
Yeah, agree, Zach. And I think the important thing to know here, team, is, if any of those challenges did, prescribe to you, just please know that they're common. They're not unusual. It's not just you. It's not something your team's doing or not doing. We hear them all the time from many different organizations, and specialty practice and within greater healthcare as well. Good news is, now that we're HIPAA data ready in HubSpot, we can support a lot of those things in a very robust way. And so, this means it's possible to secure PHI information within HubSpot. So if you didn't know that, that's an exciting takeaway to share with those today. As of inbound last year, we can store protected health information and other PII in HubSpot. Super easy to do and manage. HubSpot's done a great job of making it easy to set up. You as you can see here in the screenshot, you essentially opt in and enable sensitive data for your HubSpot instance. And on a per field basis, you can indicate whether that data needs to be protected and encrypted or not. So Pretty exciting there. Some of the key protections that HubSpot's giving you out of the box here, really detailed audit logging, encryption at a per tenant basis, advanced authentication, session timeouts, those kind of security protocols you'd expect when handling HIPAA compliant data, as well as within tool, there's these tool tips to kind of give you additional security recommendations that are kind of tailored towards healthcare organizations. So really, really easy to use and extremely helpful. Easy to implement, I think, is the key here for me. Let's look at some customization options we got here. So I think what you see here, if you can see the screenshot clearly, this is just a custom object in HubSpot. So we'll talk a bit here about custom properties, but being a CRM and a marketing automation platform, HubSpot has all the usual culprits, right? We've got this concept of companies and contacts. Most tools have their other standard HubSpot objects. For those not familiar, we've got tickets and deals. Tickets being for our service and customer service functions, and deals being for your sales teams. And so you can also create custom objects. So you've got those 4 standard objects. Those are going to come out of the box, of course. And many healthcare organizations we work with are customizing those. So you can create custom objects for things you might need. Common ones we see are patient, could be provider. We see location or office. What you see here is an example of a patient object. Slightly different than a contact object, right? Contact, you may want to email those individuals, marketing, more from a marketing perspective. This is where we're seeing, the more detailed information about the treatment, about, their protocols, any diagnoses, any next steps, best practice. And if we can look at the screenshot here for a moment, there's a lot of data here. So the purpose and kind of the ease of use here is for our front office teams to have all that information in a single place. So just looking in my system of record, in my marketing tool, in my sales tool, I can see a little bit of overview of the patient. I can see their insurance information. I can do a quick patient lookup and search other systems. You do a UI extension or something like this. I can see, details about, what we're doing for them, et cetera. So, and all of this is possible within HubSpot. So pretty exciting stuff. So your front desk teams can quickly see, more detail about the information instead of having to go into different systems. Okay. So when we look at specialty practices, whether it's dermatology, dental groups, orthopedic practices, you can customize your CRM to fit your individual clinic's needs. You can map contacts back to referring positions. That's a really exciting one. We can use companies to track different office locations, and you can track everything from billing, through the deals there, upsell opportunities, cross-sell opportunities, other referral relationships, and that can all be done really easily with native customization in HubSpot. Let's talk a bit about one of my favorite concepts, the patient journey here. And so goal of ours always in working in healthcare, particularly in our specialty with our specialty providers, is creating that connected experience and getting clarity into the entire patient journey. So as Zach said earlier, many practitioners, you could have great Google reviews and awesome practice on ZocDocs, and folks will come in, receive treatment, but you may never see them again. So that patient retention is really, really hard nowadays. And the secret sauce in increasing your retention is getting clarity into your patient journey. How are folks coming into your office? How do we get them to return? And so I won't read all the icons here, but you can essentially see if I'm a prospective patient, I'm looking for information online. I may interact with your staff remotely. There's a patient portal. I may sign up, prior to coming in. I essentially go through the process of receiving treatment. And then where many organizations miss out here is what happens after treatment. So the treatment is great. I'm a patient. I'm happy, with what's been provided. But it's, again, earlier I alluded to that transaction relationship. That's where transactional starts and meaningful begins, right? So it's sending the follow-up messaging. It's sending additional information, potentially some patient education, et cetera. And anyone who's been a long-time follower of HubSpot knows this looks a lot like the buyer's journey. So pretty exciting to see that. If any questions in the chat here, I think we've got some questions coming up related to that. But I think the theme here is this allows us to be proactive in reaching out to our patients, before, during, and after their treatment cycle instead of being reactive. Go ahead, Zach.
We've got a great question in the chat, and Jordan, I'm keeping you on your toes here. Are we able to go back to the last the last slide of the patient record. And Bryan, I'd love you to speak to this because I'm curious as well. Are there HubSpot templates to create patient objects versus just using the context? So I'll call out, this question is for Megan. We just launched being able to rename standard objects within HubSpot, meaning you can build your patients as contacts within HubSpot, but we'll call them patients. We can rename those now. I'm curious, Bryan, when you're implementing a HubSpot solution, are there templates that you're using as far as like this patient view, or are you going in and having to create custom objects every time as you're bringing new folks onto HubSpot?
Yeah, great question, Zach. So kind of a combination of all above there. So that is true. Just to call out, the ability to rename custom objects is in beta. So you'd have to reach out to your customer success manager and/or within your portal to opt into that beta. For those who are curious, you may not see that natively. There are now these industry groupings. So HubSpot is in the process of releasing kind of prepackaged kind of industry, objects that are coming out. I believe there's one on healthcare that's got some kind of like suggestions or templates there. Megan, as well as a couple other industries. And I'm told more of those will be coming in the future. So take a look into that. Happy to share some resources after the call. But what I'd say more commonly is, and it's one of those answers that depends. And I say depends, it really depends on the individual practice's needs. And so what a patient record might look like for a dental practice, you can imagine is probably very different than what that patient record might look like for an orthopedic surgeon. And so the general information about patient demographics, you could templatize that. I think probably, but on a per practice basis for an individual business, we found the patient record can actually look very different. The other thing that we see differently is the EMRs and EHRs that are used by the practices are different, and their integration capabilities may vary. So whether we can pull in billing information or insurance information kind of depends on what tools you use in your tech stack and how easy they are to integrate with. HubSpot, as we'll talk about later, is very easy to integrate with. Sometimes those other third-party tools are limited.
Yeah, and I'll call out here as well as we sit on this patient record. One, we look back to the poll of, hey, it's hard to create unity across teams. The hope within HubSpot is we create a unified system that you're all working off the same patient record. However, these CRM cards that we're looking at could be different based on the team that you're on, right? If I don't need to see insurance carrier information, that doesn't need to be there for my team's view, right? We're all working off of Jane Doe, but I can tailor, drag, and drop any of these cards or custom objects to make it look and feel like what I need to see at the top, right? So, but as I'm updating this record, it's still gonna update for everyone that's within the HubSpot system. So there's a lot of drag and drop codeless functionality here that, again, with the help of a partner like Aptitude 8, the world is truly your oyster, and we can really tailor and understand what you want this record to look like and bring it into fruition pretty quickly.
Agreed. Thanks, Zach. So we'll skip ahead here. We've got a poll coming up on the next slide here. Love a good poll. This one's similar but slightly different here. So I'd ask the chat here, which area of your patient journey do you think needs the most improvement? Is it that initial engagement, reaching out, finding those prospective folks to market to? Is it kind of during their mid-patient journey experience where they're receiving treatment and during the time they're working with the office? Is it post-care visit, or are we not sending those nurture campaigns afterwards? Or, are you struggling with the data to be able to do it in the first place, with systems integration, data visibility? Give it here in a moment to see the results come in. Data would not surprise me. That's probably the most common that I personally hear is we'd love to if we had the data in our market automation platform. All right, I think we'll call it there. Systems integration and visibility across the journey. For us at Aptitude, that is probably the most common thing we see. And again, we'll talk a little bit later about what options you have there with integration in a future slide. So more to come on that.
All right. So let's talk about what this actually looks like, right, to help improve these moments. We're going to walk through a few real life examples on how specialty practices are already using HubSpot to streamline intake, scheduling, billing, and more. This is not just in theory, but these are tools that are actually working today. So let's start with content portals built on HubSpot Content Hub. So within HubSpot, again, we're kind of hammering down like that unified system, right? Along with the integration that Aptitude 8 can provide to some of your existing tech stack. But HubSpot has what we call HubSpot Content Hub, which we can build portals in, right? So this is huge in improving that patient experience. And it's one of the most meaningful ways to provide a secure, easy to navigate patient portal. Portals give patients direct access to their records, test results, and communication with providers at any time. This reduces friction, empowers patients, and cuts down on those repetitive administrative calls that bog down healthcare teams today. These portals are often at a fraction of the cost of what you see out in the marketplace today. And you can build these portals on HubSpot Content Hub, typically with the help of partners like Aptitude 8. With these Content Hub portals, practices can seamlessly blend the portal experience into that digital journey, capturing logins, requests within a centralized system so that nothing is falling through the cracks and patients' needs are addressed quickly. So again, we're really trying to improve that patient experience. All right. So let's talk about automating appointment scheduling and rescheduling within your portal or within your website. So obstacles like fragmented communication, slow responses, and disconnected platforms cause friction for prospective patients. HubSpot removes these barriers by consolidating communication and automating follow-up. With tools like conversational bots, automated email nurturing, and integrated scheduling, we ensure inquiries never fall through the cracks. HubSpot enables you to embed self-scheduling widgets, which we're looking at here on the screen, and through workflow automation directly into your website, capturing appointment requests right into your CRM, the single source of truth. This integration ensures that patient preferences are not only honored, but also automatically trigger follow-up workflows, confirmations, and reminders, streamlining access for both the patient and your staff, right? So we talked in one of the polls of, hey, we need our teams to work together. If HubSpot is that source of truth, that can be the collaborative workspace where we're seeing appointments coming up, scheduling, and then we build these workflows to make sure that the communication is really streamlined going to the patient. And we're all singing off the same sheet of music, no matter what department or team that we're working on. All right, so let's talk about another important step of the patient journey, streamlining billing, insurance, and billing verification, right? How can we bring that into HubSpot as well, right? So we know that navigating the billing and insurance information is often a very confusing and stressful part of the healthcare journey. By digitizing and streamlining these processes, practices can remove major barriers to care. By digitally capturing insurance and billing information up front through secure forms or integrated workflows, this reduces manual entry, speeds up verification, and improves the accuracy of the information that you're receiving. With HubSpot, practices can automate documentation requests, segment communication for specific billing steps, and ensure patients have clear, timely information about their responsibilities. This transparency helps build trust and removes friction within the financial journey. Again, we're looking at another contact or patient record here. We're going to tie that within those CRM cards right back to that patient record. All right. So this all comes back to how we're enhancing that patient experience, right? And we do that within HubSpot with clear, consistent, and timely communication, which we all know is at the heart of any patient experience. But today it's really easy for messages to become fragmented across phone, email, web forms, and even text. They can lead to delays, missed responses, and frustration for both the patients and staff. With HubSpot, we can centralize all this patient communication into one easy-to-use platform. The Unified Conversations inbox, which is a feature within the HubSpot customer platform, brings together emails, website chat, SMS, and form submissions so that your team can see the full context of every interaction. We can build automated templates that route secure messages that get to the right person fast, while personalized workflows keep patients updated without your team having to lift a finger. And that's what we're looking at here on the right-hand side. If you're familiar with HubSpot, you're familiar with the workflow tool. But with the launch of HIPAA, we can start to bring in some of that HIPAA data into these workflows and just create a much more streamlined experience. And not only does this reduce the administrative load on your staff, but it also guarantees that no patient question or concern goes unanswered. And the end result really is faster response times, fewer drop balls, and a seamless professional experience for every patient at every step of their patient journey. I'm sure we've all filled out a form on a specialty practice or something we've done, and we get a call or text back, and if they don't stay on top of it, it's harder to book that appointment, right? Like I know I've got things that I've filled out and I'm like, okay, I still want to do that. But if they're not, constantly staying top of mind in my inbox, like we're extremely busy humans, right? It's going to be harder for me to go back and book if they're not, giving me that timely messaging at the right time. HubSpot allows you to automate this, and we're able to track, okay, a form fill was 6 months ago, but because we hit them with 30 emails, 50 texts within here, we finally got that appointment booked, and look at what they're spending with us, and they can become a lifetime advocate for your specialty practice. And that's really what we're trying to represent here within this webinar. All right, so I want to hit on PandaDoc, and Bryan, I know you've got some good experience with PandaDoc. Working with some other organizations. The big piece here that I want to highlight is there's a lot of different e-sign tools and form intake tools, and we all know that paperwork and consent forms can be a major bottleneck in the patient intake process. This often requires patients to print, scan, or even come in person just to complete their documentation. This slows things down considerably, introduces errors, and creates unnecessary frustration for everyone involved. With PandaDoc, we can completely digitize this experience for your specialty practice. Patients can review, fill out, and securely sign intake forms, consent documents, or insurance authorizations from their own device. This not only is going to speed up the process, but it reduces time spent in the waiting room, but also increases accuracy and regulatory compliance. What's even more powerful is that PandaDoc integrates seamlessly with HubSpot. That means as soon as a patient completes their forms, that information can be automatically logged back to that contact record that we've showed a couple times here today. We can trigger automated next steps like appointment confirmations, follow-up emails without any manual intervention by your team. Ultimately, using PandaDoc for forms and signatures turns what used to be a friction-filled manual process into a smooth, convenient, and patient-friendly digital workflow, freeing up staff time and helping patients move faster within their care journey. And yeah, as we stick on the slide here, I've worked with PandaDoc on a couple use cases, but Bryan, when we were preparing for this webinar, you really sung PandaDoc's praises, and would love to understand what you've seen in the marketplace and why, when you're trying to digitize this journey for folks, why you kind of lean on PandaDoc and some of the benefits you've seen there.
Yeah, no, thanks for that, Zach. Really a couple of things. We work with a number of document softwares particularly within healthcare. Form Stack's fairly popular. We see DocuSign quite a bit. But we're big fans of PandaDoc at Aptitude, and the reason that we like PandaDoc is ease of use. It's easy to implement. I think the native integration of HubSpot is super smooth and easy to use. And you kind of already said it there, right? The fact that the forms can be quickly deployed, the data can be automatically pushed back into HubSpot natively without the need for an additional integration that may cost additional money. It just makes the whole process super easy. So for us, it's easy to implement. Our prospects like it. It's easy to use. And it also doesn't take like a system administrator to manage it, right? I think we find that our marketing and front desk teams are super comfortable working within PandaDoc and making updates, making changes, deploying forms, instead of having to rely on more technical resources like some of those other document management systems require. Let's do it. So this is a case study of ours here at Aptitude that we like to share here. We can go to the next slide. We'll talk a little bit about some of our friends at Intersurgical. So they are in the pulmonary industry of medical devices and specialty care. We did a project with them where we migrated from Microsoft Dynamics over to HubSpot. And so they had an acquisition in play here. When they acquired Pulmonine, they had overlapping systems. They had disjointed systems. The one sales team couldn't see what the other sales team was doing. And so from migrating off of Dynamics, into HubSpot, they were able to get a unified CRM. we sometimes refer to as the customer data platform. It brought all the reps together in a single system, single source of data, and we could see activity then across teams. So it was really helpful for them. About 200 people in the organization, about a third of those in sales, but essentially they had two different sales teams, acute sales and more EMS. They were operating in silos, but they sold complementary solutions. And when they were in separate systems and prior to using HubSpot, they were missing a lot of upsell opportunities, cross-sell opportunities, and just leaving money on the table, quite literally. So they also had a lot of manual sales processes. The folks that were using Dynamics were also using, some other software additionally, but getting everybody in a single tool was extremely beneficial for them. So we led the migration, the data migration from the system, did some data cleanup for them as well, consolidated into both systems, and kind of helped with the data architecture there to be a bit more scalable. But this helped them kind of redefine their sales processes and again, within one tool, but really customize it, depending on how they wanted to sell on a per team basis. So, we were able to build out pipelines for selling into their hospitals versus EMS, and also their distributors, their more B2B motions. We did a lot of process automation using the workflows, as Zach alluded to earlier, and some custom onboarding for lead routing. Their lead routing was pretty manual prior to that. We automated a lot of that, and perhaps most critically, got everybody in one system for visibility across teams. So now everyone could see the entire customer journey. They could collaborate easily on deal records and essentially just move faster. So deal velocity was able to increase. Their cycle times decreased resultingly. Just kind of a question for you, Zach here. Can you tell us a little bit more about, I shared what I've seen. Do you see other specialty providers also having similar success with simple things just like segmentation in HubSpot that's benefiting them?
Yeah, absolutely. And again, it goes back to just, the ease of use of HubSpot and, consolidating all the data that's across different disparate systems today and bringing it into one view and using those different properties or data touch points to get a lot better segmentation through like our list building tool. This can be really difficult to do in some of these larger CRMs like a Dynamics. I often hear a lot of folks in this space that are using Dynamics and they've got 100 seats, but 20 have logged in the past 60 days, right? It's kind of this big beast that is hard to tame. I'm curious on your end, Bryan, with this, like, was there hesitancy of moving off of Dynamics? I sometimes experience that, like, oh gosh, we could never do that. It's going to take 2 or 3 years. And then we start to peel back the onion a little bit and we start to understand, like, okay, like what if we brought, these objects over and we, got really strategic about the implementation. Again, that's like your guys' specialty, right, at Aptitude 8. But curious if there was hesitancies for moving off a big tool like Dynamics and like, what's their sentiment today?
Yeah, great question, Zach. There's always, a little hesitancy to make a big system move like that. And I think that's natural. But I think once we were in the project within a few weeks, the team's excitement started growing. And I would say today they're delighted to be in HubSpot is probably how I would describe it. We've got some kind of, compelling statistics here on the next slide that kind of speak to that, but they're very happy. I think your ease of use, moving faster. So let's click ahead and see what we've got done here. So, for the sales operations team, 100% adoption. You heard me say earlier, we had Dynamics, there were some other systems, we had some kind of adoption struggles. Not anymore. The team is excited to use HubSpot. Heard things like it helps us close more opportunities. We built over 60 workflows to power that. So, a lot of automation there. Zach gave some examples earlier about, where in the patient journey we fall short. We had the poll workflows, or how we want to automatically nurture those things. We don't need to think about doing that. And the biggest thing is just a lot more visibility, for reps who are working with each other, for the operations teams, and for leadership. As you look at leadership teams, getting clarity into pipeline, into health, into coverage, those kind of things. It's really hard to do in two different systems, really apples and oranges. With everything in HubSpot, they're able to do a lot better forecasting and kind of really get a better picture of their overall sales health.
I love this. And Brian, you probably saved them a lot of money on their software spend by moving them from Dynamics to HubSpot on top of all the
Also that.
That's always a win.
Cool. So let's talk a little bit more about kind of those integrations we talked about earlier. And I appreciate all the questions in the chat. A couple of folks have talked about that. Larissa and Stefan and Megan, I appreciate you. Look, HubSpot's API is super easy to work with. The data fields are open, and so it makes integrating with it, very easy compared to other tools. And so, excuse me, a couple of the common integrations that we see are primarily with EMR and EHRs we talked about. Just, there are many, but some of the popular ones that we've worked with are, Epic, Athena Health, Dr. Crono are a couple. Modern Medicine is one that's coming more frequently. And if yours isn't listed here, just take a quick look. If it's got an API that's available to you, we can generally integrate with it. The API documentation typically governs what can be integrated and what's possible, whether we can do it two-way or one-way. But HubSpot is rarely the blocker there. Some other integrations we see within scheduling. We see NextHealth a lot, Clara, and Luma Health is coming up more commonly. And so we're able to get that scheduling and appointment data directly in HubSpot. We can automate things, such using webhooks, right? If someone reaches a certain juncture, send an automated email with a booking link to book in Luma Health or something like that. We talk about document and form management there. FormStack comes up a lot. We see JotForm, again, PandaDoc here. These are all really helpful tools. I would say if your practice does not have a documented solution that is reliable, or if you're exploring other options, again, that's all that, particularly if you're using HubSpot today or considering it, that's our go-to there. And they're HIPAA compliant as well. And then call tracking and telephony. We see these also coming up more frequently. RingCentral, UpDocs, Twilio are just a couple that we see and have worked with in the past that are HIPAA compliant. You can see that call data directly logged onto the contact or deal record or even patient record where appropriate inside of HubSpot. So when your front office is reaching out to these patients, what's being said on those phone calls, and you can start to use that transcription data to make business decisions. But all of this is possible through HubSpot's, really easy to use integration and then open APIs.
All right.
So you.
Yeah. How do you get started? Right. Well, obviously you send me and Brian an email, we book some time and we start digging in. It's really easy to do, right? For those of you that are already HubSpot customers and maybe you haven't opted into HIPAA-ready features, it's as easy as a click of a button. Brian showed that earlier. It's been really cool to see some of the floodgates starting to open with some healthcare organizations that were maybe using us for B2B that have transitioned now and not only B2B, but they're starting to bring patient data in. It's going to help their marketing teams work a lot more efficiently rather than having to work out of multiple tools. If you do have a HubSpot, account CSM, I definitely would chat with them about what it looks like to turn on these HIPAA features. And then, bringing in a partner is extremely important here, right? Do not go at this alone. We don't want you to just buy software and think you can run all these integrations and strategy. And it's so much more than just, hey, connect these tools into HubSpot, right? Aptitude 8 does so much more that they've done this before and they can bring best practices into how you're, implementing a new tool like HubSpot, right? This is a great inflection point to review what processes you guys have in place today and lean on a trusted expert to bring some of those strategies and practices into a tool like HubSpot, right? There's a lot of things that they could bring to the table that say, hey, we actually tried this with another practice just like yours and increased lead conversion by 25%. Okay, cool. Let's build that in to our future state within HubSpot, right? So all of my larger partnerships have some sort of implementation partner, and I work with Aptitude 8 quite a bit and couldn't recommend them enough. But it's really good to get a third party to come in and really help, get HubSpot off the ground for you. To double down that comes back to some of those custom integrations, hands-on. I know there's a lot of, questions in the chat around, does it integrate with this? Does it integrate with this? And the answer is yes, but we got to do some scoping, digging in and figure out what are the best paths. And there are some middleware and things that, again, Aptitude 8 works for. That's really the fun part, right? Is hey, let's scope this out. Let's envision what future state's going to look like in HubSpot with all your existing tools, and let's bring it to life. And you'll notice that we can bring it to life pretty quickly. We're not talking 12-month implementations. Like, Bryan, I don't know what you guys are like, what your average is in the space, but I mean, I typically see anywhere from 3 to 6 months where, you're gaining value out of HubSpot a lot quicker than some of the other CRMs in the space.
Yeah, I'd say 3 to 6 months is a pretty good target there, Zach. And what's unique about HubSpot, in my experience, is with other software implementations, your users can't really get value out or sometimes even log in until the end of the implementation. And that's not true with HubSpot. We look to get users in there getting early value within the first 6 weeks, while we're working on the additional things and user acceptance testing and any integrations. But it's there's a lot of stuff that's ready to use pretty natively and out of the box. So, getting users in the tool even well before the implementation is complete.
Perfect.
All right, we've got a wonderful Q&A today. So there's a Q&A function here in the tool, if I'm correct here.
Yeah, let's see. Oh, here we go. Yeah, we're learning on the fly here. All right, so Dario has, what if an account doesn't enable HIPAA and instead serves PHI in another platform? How would HubSpot fit in the website if hosted there? Bryan, have you encountered that?
We have. And so, when it's stored in another platform, it's usually in a data warehouse or something like that. And so the method there, Dario, is usually just an integration with that tool instead. So it's not uncommon for an EMR HR to push that secure data into another tool. And then we would just connect HubSpot to the other tool is typically how we would do that. So same, just another step. And many clients, that's actually their preference, is to use tools like Amazon Web Services or Azure or Google Cloud Platform or some other, application hosting where we would connect with that system. Good question.
Perfect. All right, we got one from Haley. We talked about this a little bit, Bryan, when you onboard in some of the custom patient views, but are there any pre-built healthcare specific report templates in HubSpot? I'll take a stab on my end, being the HubSpot guy. I don't know for sure. I think we're going that route. And as Bryan mentioned, like every specialty practice is so different, like with different objects, with different properties. I'm sure we could get you like a baseline of what, like what the patient journey might look like. But Bryan, I'm sure you've built out some dashboards that you maybe copy and bring into existing portals. And yeah, I don't know if you're able to share like what you typically see as like a dashboard that, drives a lot of impact or gives like top level, efficiencies gained by HubSpot.
Yeah, there's over 200 out of the box reports and dashboards with HubSpot, which is great. That's a really good starting basis. And that's across, all the tools, whether it's marketing, sales, service. So there's plenty to use out of the box. What we see commonly in healthcare is custom dashboards. So a lot of the standard reporting, it is pretty agnostic. It works great for healthcare organizations, and in traditional marketing, we might call it customer journey. In healthcare marketing, we call it the patient journey, but essentially the steps are basically the same. So a lot of the native reports work great, Haley, is what I would say, but we do see a lot of customization in dashboards, things like, providers, referral partners, revenue by doctor, things like that. So we see some pretty complex dashboards being built out, but, using the native reporting.
Perfect. All right. I love this one from Jessica. Is this only for larger health systems groups? What about solo private practices? And I would say it is for everyone in the space, right? Like that's a beautiful thing about HubSpot is it is built for the end user. It's powerful, capable, but easy to use, right? Just because you might be a smaller private solo practice doesn't mean that you're not using the same tools that our biggest practice on HubSpot are using. Like we don't like you're buying into the platform, right? So absolutely, you can use it as a private solo practice. I would just call out the HIPAA functionality is unlocked within our enterprise version. But again, that enterprise version is what our biggest specialty practices on HubSpot are using, right? We're not, giving them something more than what you'd be getting. So it's really about the use case. And we have a lot of specialty practices that might not even need HIPAA data included, right? If it is just from like a high level marketing standpoint, but HubSpot's easy, scalable, and really built for everyone. Bryan, I don't know if you want to double down on that, or I'm sure you've seen customers come through on your end from all different shapes and sizes that are employing you guys to kind of roll something like this out.
Yeah, no, we just to say, it is for everyone, truly. I mean, there's price points that work for everyone now. We've worked with, single member, single provider practices up to, multi-location, many providers. And, as Zach mentioned, a number of the healthcare tools are available at the enterprise level. But as of last year, HubSpot has a per seat model now, where if you're a smaller practice or, that, may not need your whole sales to be on enterprise, you can even purchase a single enterprise seat now. And that can unlock all of these features for your practice. So it's pretty attainable from a price point as well, which is pretty exciting.
Perfect. All right. We got questions coming in here from Matt. Can the customer portal be adapted to display data beyond a ticket? For example, customer address.
It can. So there's kind of two different things with similar names, what I would say, Matt. So there is a native kind of customer portal that comes with HubSpot's Service Hub, and that is intended to work directly with the Service Hub. It is ticket based. So that is a HubSpot tool, within the Service Hub. Within the CMS and content hubs, we actually have the ability to build out a custom patient portal, and that is more, more flexible and can use a number of objects. So that there is a bit of a web build there, but that is done in CMS, and now we call Content Hub, where we would build out, the front end architecture, UI, what you'd like it to look like. It typically looks and feels like your website, but that can be built more on the CRM architecture for deals or patient objects or what have you. So similar tools, but different parts of HubSpot.
Perfect. Yeah, and we've seen a ton of really creative portals built on HubSpot Content Hub. You can do a lot of great things, and you can leverage a lot of the data you have within your CRM within that, which it expands a lot further outside of like just the ticket information. All right. Oops. Learning this new contrast. Okay, so we've got a big one from Stefan here. Really about, and Stefan, it sounds like you're looking to segment activities on each customer record based on the team. Like, I don't want to see on a contact record or patient record Bryan's communications with that person. I just want to see my team's communications. I'm pretty sure we can do that. And Bryan, keep me honest on that. You can sort by team on the contact record now, and then lock that down based on, some of the governances and things like that. I know we can set it up to where Bryan couldn't update portals that maybe I could update based on the team that he's on. But we do have drop downs now within the company and contact record that allow you to sort activity by team.
Yeah, that's correct. I mean, so we can do some basic kind of filtering by activities and views there. There are some limitations there. I would call out. Stefan, I'd love to, hop on a call and dig in a little bit more of the use case specifically for you here. But when we look at permissioning for healthcare organizations, there's a couple components to it. There's teams. We look at, it's called hierarchical teams, that we can permission there as one level. And the second component is at a field level. So we can make some fields visible for some teams versus not for others. And I think Josh dropped it in the chat earlier. We can also do conditional logic and field dependent properties and stuff like that is another way to permission it. And activity reporting is different than that. I just kind of want to call it the whole permissioning picture. As far as best practice for data governance, we recommend our healthcare organizations have a data policy, and how, to use the data in HubSpot, how we have it help with that. But, that can determine and guide who should use it versus who can't, what access super admins have, versus your normal users and managers, et cetera. But, just discuss that as an organization and kind of define your policies. And then, working with your HubSpot partner or on your own, you can configure it that way.
Perfect. We've got one more here from Liz that I'm really excited about. So I'm trying to apply this model to a nonprofit setting that provides childcare referrals, mental health, and other wraparound services. Can you share licensing strategies to keep implementation affordable? I would call out just from the HubSpot side of the house, we do have nonprofit pricing that it's a great benefit. It's a 40% discount on your licensing within the software. So that's a really good start. And then as far as implementation integration, like Bryan, I'll tee up for that one. I'm sure you guys have some experience with nonprofits, and I'm sure you guys are flexible to work with them. But yeah, we're always willing to take these conversations and see where HubSpot can make an impact.
No, yeah, same. I think HubSpot, does a great job here. There's a wonderful program, Liz, for nonprofits. There's software discounts, there are other programs and some ancillary support as well available for nonprofits using HubSpot. On the services provider side of things, many partners do have discounts for nonprofits. But count on us to be flexible. Here at Aptitude, we work with a number of nonprofits, and understand that budgets are sometimes challenging, and there's different times of the year where you may have access to funds versus others. We can make that work. And then the other HubSpot partners care deeply about the work that you do in nonprofits as well, and share that sentiment.
Perfect. I think that was our last one. I don't know, Jordan, are you able to hit the next slide? Maybe I can. We get out of this Q&A. Okay, there we go. Fun. All right, so here's some helpful resources. Please fill out. I think are we going to another poll? If not, we will definitely follow up. Oh, here we go. Yep, interested in receiving a demo for your specific use cases. If you are interested, definitely fill out. Hopefully we get 100% yeses here. We were close. We were tracking nicely. And then that gives us the ability to reach out to you one-on-one and really dive into your specific use cases. Again, the most fun part of my job, and Bryan, I'm sure you can attest to this, is understanding where you're at, diving into some of the nuances, and then showing you what it can look like in the future to help improve your efficiencies and take your practice to the next level. So I love that. I geek out on that, and getting with a company like Aptitude, a partner like Aptitude, just makes that experience so much more seamless because they can bring their knowledge to the table. But we're definitely excited to be in touch with anyone who wants to keep the conversation going, and we'll send out some of these resources as a follow-up in an email as well, as we discussed earlier. And yeah, feel free to shoot us an email directly, hit us up on LinkedIn. Yeah, I think that's all we got. Bryan, any closing words you want to leave us with?
No, I'll just say thank you to everyone. And if your practice has considered HubSpot in the past or not, but are experiencing the challenge we talked about earlier, the fragmented data, the data missing maybe for your patient journey, or the ability to market and sell to your patients throughout the journey. HubSpot's a great fit. I'd encourage you to take a look, and I'm sure that Zach and certainly myself would be happy to kind of walk you through an evaluation to determine if it worked for you all.
Awesome. Well, thank you, everyone. We really appreciate it, and have a great rest of your day.